Hello,
Hello.
I'm here to see Dr. Miyauchi. So we're here at Kuma Hospital in Kobe, Japan, and it is where Dr. Akira Miyauchi practices. Dr. Miyauchi is world renowned as a thyroid cancer researcher, and he's really the godfather of active surveillance. So let's go ahead and get started. Dr. Miyauchi, good to see you.
Hi, nice to see you again.
You were talking how some patients the tumor actually shrinks over time.
Yes. Well, during active surveillance, we periodically measure the tumor size with ultrasound. And when I calculated doubling time of tumor volume of the papillary microcancer, I found that some of the papillary microcancer actually decreased in their tumor volume over time. In our calculation, about 17% of the papillary microcancer showed decrease in their tumor volume over time.
My feeling is almost saying things will get better.
Well, I do not say cancer in general. I'm talking about the only small papillary thyroid cancer. We are doing active surveillance for low risk papillary microcancer, which is smaller than 1 centimeter in maximum diameter. And during active surveillance, about 17% of the patients showed decrease in tumor volume, and about 3% of the patient showed rather rapid growth in their tumor volume, and 22% of the patients showed slow growth in their tumor volume. So, and the remaining about nearly 50% of the patient showed stable disease, almost no change in their tumor volume. So, even among the papillary microcancer, their tumor nature or characteristics or behavior varies according to their cancer. So all papillary microcancer has same characters. So nobody can tell which one will show tumor growth at their presentation. So I think very important thing is just observe. Periodical observation, we can identify which one shows tumor growth or progression. There are many reports that many kind of human thyroid cancer actually showed decrease in tumor size. Typically, childhood cancers might show decrease in tumor size. For example, retinoblastoma or Wilms tumor or something like that. So spontaneous decrease in tumor volume is rare, but not extremely rare. And I do not know the true reason, but during my observation of the papillary microcancer in our patients, as I told you, that about 17% of the patient showed decrease in their tumor volume. But at the same time, 3% of the patients showed rather rapid growth in tumor size, and 22% of the patients showed slow growth in their tumor size. the very important point is that we cannot tell which one will grow in the future. So important point is we need to check up regularly. Yeah, so I think active surveillance is very important to discriminate good one and bad one. Mm-hmm.
The ones that are decreasing,
Mm-hmm.
is there a common denominator in those patients? What's happening?
That is a very important question, but honestly speaking, the decrease in tumor volume in thyroid cancer is not a common concept. But for many years, childhood or the thyroid cancer in young patients has a very unique or peculiar phenomenon, shows peculiar phenomenon. I mean, the young patients tend to present with rather large tumor, and they might present with lymph node metastasis, and they might present with distant metastasis. However, patients younger than 45 years are very unlikely to die with their thyroid cancer. And that is very well confirmed by many researchers. Nobody can tell why, but, well, doctors, surgeons might be satisfied with their surgical skill in doing complete surgery, but I don't think that is the main reason. And the radiologist might be satisfied with the radioactive iodine treatment results. And that may be one reason. And endocrinologists might be satisfied with their TSH suppressive therapy. Well, that might be one reason, but all of these, I don't think all of these, only all of these cannot completely explain why childhood patients, childhood thyroid cancer has such an excellent prognosis. So I think it's a kind of natural course, natural history of childhood thyroid cancer. It is not easy to present convincing evidence, but we have several data. My young colleague, Dr. Kasahara, reported doubling time in childhood thyroid cancer patients, and he reported doubling time, serum thyroglobulin doubling time decreased over time in some of the patients. So I do not know the true reason, but I think some of thyroid cancer, papillary thyroid cancer, showed spontaneous decrease in tumor volume or spontaneous regression of thyroid cancer. That is occurring.
Could it be a lifestyle?
I don't think so. I don't think so. I do not know the true reason. Maybe it's simply related to age, but I do not know the true reason. I'm a surgeon. I'm a clinician. I'm not a researcher or molecular biologist, but From my observation, clinical observation, I can say some patients showed spontaneous decrease in tumor volume.
When you meet with the patient, you're going to say, you know what, in some cases, the tumor's going to get
Yes.
smaller.
Well, yeah, the general or fundamental concept of cancer in general is continuous growth. That is a very basic concept of cancer in general. But there are some exceptional cases, and we are talking about the papillary thyroid cancer. For papillary thyroid cancer, by some reason, spontaneous slowdown is not so rare phenomenon. But at the same time, we should talk about the spontaneous aggravation of the growth rate. At the same time, I have seen some patients show sudden rapid increase in their tumor volume. So both can occur, spontaneous decrease in tumor volume and spontaneous acceleration in growth rate. Both can occur. I do not know the exact reason.
How often are you having to monitor a patient diagnosed that is under
Basic observation is 6 months after the initial diagnosis, and then once a year. But maybe the initial several years, maybe every 6 months might be good. But maybe after 2 years, once a year might be sufficient.
over a 6-month period? Can you translate that? Does that
No, actually, our definition of the tumor growth is growth in the tumor size, the maximum tumor size by 3 millimeter or more. So if the initial tumor size is 7 millimeter in the tumor maximum tumor size, if the tumor comes to 10 millimeter or more, we judge the tumor showed increase in their tumor size. So, but 1 centimeter papillary thyroid cancer is still a small thyroid cancer. We can say these tumors can be safely treated by appropriate surgery.
they're not hearing the size of the tumor. They're only hearing that they have papillary.
Dr. Michael Tuttle is one of my good friends, and we have a similar idea, similar concept that doing surgery for all small thyroid cancer will result in more harm than good. But unfortunately, Dr. Tuttle and I do not diagnose which one is bad, which one is good. We cannot tell at the presentation. So the important point is regular checkup is very important. During the regular checkup, if the tumor shows increase in tumor size or appearance in small lymph node metastasis in the neck, we should perform a thyroid operation for such cases. And doing surgery only for these patients, we can save many unnecessary surgeries for patients with, I'd say, less aggressive cancer.
You say the word metastasis. Are there any patients currently under active surveillance that you're treating that have a little metastasis?
Yes, during active surveillance, some of our patients showed lymph node metastasis. But very interestingly, younger patients, I mean younger than 40 years, at presentation tended to show lymph node metastasis. But this is well confirmed by many researchers. The patients' papillary thyroid cancer in younger patients has excellent prognosis. So I do not worry the appearance of small lymph node metastasis in the neck in younger patients. I worry, honestly speaking, I worry that appearance lymph node metastasis in older patients, I'd say older than 60 years. But from our experience, the appearance of lymph node metastasis in older patients, older than 60 years, is extremely rare. It's very rare. Lymph node metastasis in papillary thyroid cancer, we should think about the age of the patient. Young age, I'd say younger than 45 in the past data, but now maybe younger than 50 or 55, the small lymph node metastasis in the neck is not a strong prognostic factor. There are very high chance to cure the patients. But if the lymph node metastasis is seen in older patients, older than 60 years, it might be a bad sign. But at the same time, whether it shows growth or not is more important. Older than 60 years, lymph node metastasis, and that is growing. It's a very bad sign. Elderly patients are less likely to respond to radioactive iodine treatment, and especially the tumor is growing.
What is the worst case scenario for that patient? What could happen if there's not surgical?
Well, there are many cases. The tumor might grow continuously and to compress the surrounding important organs such as trachea or esophagus, or they might get rupture to bleed, or the more concern might be appearance of distant metastasis to the lung or bone or liver or even brain. So distant appearance of distant metastasis should be the worst scenario, and especially they are not responsive to radioactive iodine treatment.
Even though there is some spread to the lymph node, that in fact we can watch that patient?
No. If during the active surveillance for low-risk papillary microcancer, if the lymph node appeared in the lateral neck of on ultrasound examination, we usually put the needle into the suspicious lesion and do fine needle aspiration. And also we measure thyroglobulin on the aspirate. So if the thyroglobulin level is high, that is a sign of the metastasis of the papillary thyroid cancer to lymph node. In such case, we recommend surgery but appearance lymph node metastasis, but usually in that way, the lymph node is smaller than 1 centimeter or something. So it's a small lymph node metastasis, and the number might be only 1 or 2. So it's surgically resectable. So we don't think it's a very strong prognostic factor. There is a very high chance of the cure by surgery.